Throughout history, there have been times when shocking, strange, and unbelievable things happened, moments that defy logic, reason, and explanation. Some were tragic, some were mysterious, but all of them left a mark on history. Welcome to Truth Vault, where we uncover the stories that time tried to forget. In February 1994, in Riverside, California, a 31-year-old woman named Gloria Ramirez was rushed into the emergency room. She was suffering from late-stage cervical cancer, barely breathing, her heartbeat fading. But what happened next would turn this ordinary night into one of the strangest medical mysteries in modern history. As doctors and nurses began to treat her, a strange odor filled the room. Some described it as ammonia mixed with something metallic, almost like garlic or chemicals. Moments later, one of the nurses treating her collapsed, then another. Before we continue, don't forget to like and subscribe for more real-life stories from Truth Vault, where history hides its darkest secrets. Within minutes, the descended into chaos. More than 20 hospital staff began to feel dizzy, nauseous, and faint. 5 people had to be hospitalized, and 1 nurse spent 2 weeks in intensive care. All of this from one patient. The hospital declared an internal emergency and evacuated the entire building. Gloria Ramirez was left alone in an isolated trauma room, and despite every effort, she died that night at 8:50 p.m. But her death was only the beginning. Investigators from the California Department of Health were called in. They tested the air, the equipment, the blood, everything, but nothing made sense. There were no known toxins, no chemical leaks, and no contamination. Then came the strange part. When they tested Gloria's blood, they found crystals of an unknown substance floating in her plasma. Some speculated she had applied dimethyl sulfoxide, a home remedy cream used for pain relief, to her skin. When mixed with oxygen during medical treatment, that chemical could have transformed into dimethyl sulfate, a highly toxic gas. That theory could explain the symptoms, but not everything. The hospital staff who had the worst reactions weren't even near our blood. Others claimed it was mass hysteria, a psychological reaction triggered by panic and fear. But even decades later, no official explanation has ever been confirmed. Was Gloria Ramirez a victim of her own desperate attempt to heal herself? Or was something far more mysterious at play that night? No one knows for sure. What we do know is that she's now remembered by a chilling name in medical history, the Toxic Lady. This has been Truth Vault, where we uncover the strangest real stories hidden in the folds of time. Don't forget to like, subscribe, and comment what story you want next.